DataWalk is a multi-user software platform for collaborative, intelligence-led decision-making. DataWalk enables all of your data and related work product to be stored, accessed, analyzed, and shared via a central repository. In an earlier demo, we showed how DataWalk enables you to easily identify and monitor risk of individuals associated with spreading coronavirus. In this next demonstration, we'll focus on presenting how DataWalk can support authorities with operationalizing those results to effectively reduce the risk of the virus further spreading. Comparing the results in Italy and Spain with South Korea, it's clear that effectively managing available medical resources can reduce the number of deaths by a factor of 10. We'll start with the anonymous mobile device data logs for Italy, and for this demo we've added data for hospitals in Italy and their available resources such as respirators, number of hospital beds, and so forth. We also use demographic data downloaded for each region from the official Italian Central Statistical Office, and we leverage fictitious reports simulating notification through the emergency 112 number. Other data, such as passenger records from the previous demo, are still available here for further analysis. The environment can be enriched with data manually imported through Excel drag and drop, as well as big data sets added for further analysis, such as enriching the machine learning model to improve effectiveness of predictions. All of these data sources are available for authorities around the world. In our case, some of this data is fictitious, so no one viewing this should take action based on the conclusions presented. Now we'll use this data to demonstrate how DataWalk can support local authorities in establishing and monitoring quarantine areas. We'll also predict potential growth areas of COVID-19 infections and the potential scarcity of medical resources. Let's start with our confirmed COVID-19 infection cases. First, we'll apply a filter for the date of confirmed cases, and we'll use a histogram to select only areas that currently have a significant number of infections. We visualize results on a map, and we immediately see cumulative rates of virus infection. We can zoom in to see a single region in Italy, specifically Milan. Then we can use a polygon to designate a quarantine zone. Then we move to an instant analysis panel where we have a rule cell phones out of a quarantine zone. Coupling cell phone data, we can generate an alert as shown here, which will inform us when anyone leaves the quarantine zone. Depending on the data we have access to, we can see the place of stay, place of living, or even identify a specific phone number and name of an individual who does not respect the quarantine. So what you've first seen here is that DataWalk can use various types of data to establish and monitor adherence to quarantine restrictions, which can be crucial to stop the spread of the virus. In the next example, we'll use machine learning to predict potential areas of COVID-19 infection growth and the general risk of a shortage of medical resources resulting from overcrowded hospitals. To perform this, we'll add an Excel or CSV file indicating calls to the emergency 112 and 999 numbers, where there have been over 1 million such calls. This data can be added automatically or manually through an Excel or CSV file as shown here. The process for importing over 1 million objects takes a few minutes, and data is then ready for analysis. Now we review data for the underlying Italian regions and areas. We select all regions, and in the DataWalk App Center we select the machine learning model to predict places with a potentially significant increase in infections in the coming days and weeks. Now the system uses all available data such as calls to emergency numbers, data with suspected and confirmed cases, cell phone data, and demographic data. This can easily be expanded with whatever additional data you may have available for analysis. Typically this process takes a few minutes, and we then see in the infections predictions dataset the total number of predicted infections for the next 1, 2, 3, 4, and up to 10 days. We also have an indicator which compares the total number of cases to the number of available hospital beds for these next few days. We can visualize this on a map and via time series analysis, and we immediately see that on April 2nd we can expect over 155,000 cases in the area around Venice. Based on this prediction, we built alerts for the top 10% of places with the highest predicted shortage of medical resources for the next 1, 3, 7, and 10 days here on the Workspace panel. To simulate how this might work, we click on the Scarcity in 10 Days button, And we see the top areas with the poorest coverage of equipment relative to the number of potential infections. And we see 3 regions, Como, Milan, and Pavia, where Como has the highest rate of infections to beds in the next 10 days, which reflects areas with the greatest risk of a significant shortage of medical resources in the coming days. Then we select this region and open the summary to see all hospitals in the region with a deficit in resources and potential places from where resources can be moved considering their small number of predicted infections for the next 10 days. This type of analysis will help authorities to build predictive situational awareness, to better manage the crisis situation, and to effectively manage resources in advance. To learn more, contact us through our website at datawalk.com.